Hey guys, I'm Dr. Jason Barker with the Natural Athletes Clinic, and today I want to talk to you about advanced cardiovascular testing. So normally you go to the doctor's office and you just get a standard lipid profile, and that entails measuring your total cholesterol, your HDL, your LDL, and your triglycerides. Now, we all know that a cholesterol under 200 is considered safe. However, even if you've got safe levels of cholesterol and you have a lot of inflammation in your bloodstream and in your body, that's a really bad mix because that inflammation creates stickier cholesterol molecules, and that's how you gum up your arteries and get heart disease. Now, in the clinic, I like to use more advanced cardiovascular testing, and this involves using a lipoprotein profile. And what that does is it is a more efficient way of counting the molecules, so it's more detailed. And then also, more importantly, it measures the size and the shape of those cholesterol molecules and the density of them. So if you have small, dense cholesterol molecules, those are more dangerous because they can more easily insinuate themselves into the lining of your arteries, setting you up for heart disease. Whereas if you have larger, fluffier molecules, we don't need to worry about those as much because they can't get into the lining of the arteries as well. Now, besides the cholesterol and these lipoprotein profile tests, they're called, we can also look at other markers of how the cholesterol is carried around and distributed in your body. So we can look at things called apolipoprotein A1, apolipoprotein B, lipoprotein little a. There's some other molecules like that. Now, that's all in that lipoprotein profile. Now, you want to also check out the markers of inflammation. This is just as important. So we're looking at things like highly sensitive C-reactive protein. That's a big one. We're looking at something called homocysteine. This is an amino acid breakdown product that floats around in your bloodstream and is also atherogenic or can create heart disease. We're looking at blood sugar and historical records of blood sugar, hemoglobin A1C. We care about that because if your blood sugar is elevated, that tends to give you insulin resistance, and people with insulin resistance, elevated levels of blood sugar, that also can stimulate the production of heart disease. So you need to get these more advanced tests done. And now, what happens if you have a problem with cholesterol? Well, the first thing we need to think about is getting that inflammation down. So you know the story here, so you need lots of omega-3s. You need to use things like curcumin. If you've got an elevated homocysteine, there are B vitamins. A B complex is really good at lowering that level. It helps process that homocysteine and gets it out of your system. And then we also use cholesterol formula. Now, this is a collection of natural medicines and herbs in there that will help lower that cholesterol safely. It's not a statin. We don't like statins in our athletes because statins are notorious for causing muscle aches and pains and even weakness, and they can also cause problems in your liver in some folks. So we like to stay away from those as best we can. But again, yeah, the goal is to lower cholesterol, but even more importantly, the goal is to lower inflammation in your body. So those natural medicines I just mentioned, plus of course, again, the whole food diet, lots and lots of plants, avoiding excess red meats, alcohol, processed foods, sugary foods, all those inflammatory foods that you know about just increase your risk of inflammation. So changing up the diet, using things like curcumin, a B complex, and omega-3, cholesterol formula, that's a great way to get that inflammation and that cholesterol under control. But make sure you ask your doctor for this lipoprotein profile and in those inflammatory markers, and we've got them up on the slides in here so you can write them down. Go ask your doctor. Now, a lot of doctors are too conservative to order this test. Don't take no for an answer. Hunt around for somebody that'll help you out, or give us a call. We can run those labs for you regardless of where you are in the country. Okay guys, stay safe, stay healthy, keep watching. Please give us a like if you enjoyed this video. Please share it with anybody you know who struggles with high cholesterol or inflammation. And of course, please subscribe to the channel, and I'll see you again next time. Bye.